Welcome to The Explainer. Today, we're diving straight into a really fascinating and honestly, a very specific medical mystery. You've probably seen the headlines buzzing lately about a cluster of hantavirus cases, and they all trace back to just one single ship, the motor vessel Honduras. Now, it's super easy for news like this to just spiral right into panic, but our goal here today is to cut through all that noise. We're going to break down the exact mechanics of this outbreak using clear facts, hard data, and precise timelines straight from the latest expert analysis.
But before your mind jumps to the absolute worst-case scenario, let's look at the bottom line from the experts. And it's pretty clear, I certainly don't think there's going to be a significant outbreak. So we're replacing fear with facts today. Yes, there's some important nuance here, and sure, we might see a few more isolated cases pop up, but the data right now absolutely points away from some massive global event.
Okay, let's dive into this. First, we'll look at the ship outbreak itself, then the actual mechanics of how it spread. After that, we'll map out a timeline of critical dates to watch, and we'll wrap up by balancing the risks with some incredibly good news. Part 1, the Hantavirus ship outbreak. Let's start our detective story right at ground zero. To really understand this outbreak, you've got to picture the environment. We aren't talking about a virus tearing through a crowded, bustling city. No, we're looking at a highly specific, totally closed ecosystem. Literally just 149 individuals out in the South Atlantic. That's 88 passengers and 61 crew members. This confined, lockdown environment is absolutely key to making sense of everything that happens next. So how did the whole thing actually start? Well, it all traces back to our patient zero, a 70-year-old Dutch national we'll just call Leo S. He's the one who brought the virus onto the ship. And from him, the virus spread to 9 other people on board, including his wife Miriam. So that brings our grand total to exactly 10 confirmed cases on the vessel. One person sparked 9 further cases. I want you to keep that 1-to-9 ratio in the back of your head because you're going to unpack exactly what that means for transmissibility in just a second.
Section 2, Mechanics of the Spread. This is where we answer the big why and how. How did one guy infect 9 others on a boat? Okay, so to figure out the real risk here, disease detectives track what they call generations of spread. It's actually pretty simple. Generation 1 is patient 0. Generation 2 is his 9 direct contacts. But Generation 3, that's the one we're really watching out for. That's when the virus escapes that initial group and gets out into the wider community. But here is the critical thing to remember. Right now, all known cases are completely contained within Generations 1 and 2. Now, what's really interesting about this slide is the context of that transmission. On the ship, one person infected 9 others. In epidemiology, that gives us an R value of 9. Now, that sounds terrifying, right? The Omicron variant of COVID had that same massive R value, but it did that out in the open public. This specific strain of hantavirus, it only hit that R value strictly inside the walls of a cold, windy ship where people were practically living on top of each other indoors. Out in normal, everyday society, experts expect that R value to just plummet.
Let's talk about how it actually spreads. Traditionally, hantavirus moves through bodily fluids, saliva, sharing food, or, really close physical contact. But here's the wild variable in this case. The demographic on this ship was mostly older adults. As the analyst pointed out, it's pretty unlikely this group was throwing wild parties, sharing drinks, or engaging in heavy social mingling. Yet, the spread still happened. Because of that, the ship's doctor actually suspects that just normal, everyday social contact led to close proximity airborne transmission inside the boat. That potential airborne factor is exactly why public health officials are taking the contact tracing so incredibly seriously.
Section 3, Timeline of Critical Dates. With those mechanics under our belts, let's map out the exact future dates we need to be watching. The real villain of our timeline here is the ridiculously long incubation period of this virus, specifically this Andes strain of hantavirus. Unlike a normal cold where you might feel gross a couple of days later, this thing can incubate anywhere from 1 to 8 weeks before a person even shows a single symptom. The peak window for symptoms to actually kick in is usually between 22 and 28 days. That massive lag time is exactly what turns tracking this virus into such a nerve-wracking waiting game. So let's walk through this waiting game, step by step. On April 24th, 29 passengers got off that ship and hopped on flights all over the globe, well before anyone fully realized the viral risk. They could have interacted with hundreds of people. If we add that peak 22 to 28-day incubation period, it drops us right in the middle of May, roughly May 15th through the 19th. If anyone from the general public, our Generation 3, starts showing symptoms in that window, it means the passengers were spreading it before they even knew they were sick. Now, if those original passengers only became contagious after they got sick, their contacts wouldn't show symptoms until around June 5th. And finally, because of the extreme outer edge of that 8-week window, experts say we literally cannot officially declare this event over until the very end of June. If late June rolls around with 0 new community cases, the outbreak is officially clear.
Section 4. Good news and risks. Let's balance out those intense timelines with some extremely positive updates.
So the crucial point is understanding why health authorities are sweating over this, even if widespread community transmission is super unlikely. Well, for the people who do actually get sick, there's an estimated 15% mortality rate. It is a really severe illness. Because the stakes are that high, literally every single isolated case matters, and that's why officials are monitoring this with such intense scrutiny.
But right alongside that scary stat, we have some fantastic news. First off, there was a KLM flight hostess who directly cared for Mrs. S on her flight home. She got sick and everyone suspected the virus, but she has been completely cleared. Whatever she caught, it wasn't Hantavirus. Second, and this is huge, there are currently 0 Generation 3 community cases. None. The known cases are all safely isolating. And finally, because the incubation period takes so long, simple antibody blood tests are actually highly effective by the time someone finally feels sick. That means doctors don't just have to guess or rely solely on PCR swabs to know exactly what they're dealing with.
To wrap things up, I want to leave you with a really fascinating point to chew on. The analysis noted that Moderna actually started working on a hantavirus vaccine back in 2024, and it begs the question, was that just some academic side project, or was it incredible foresight into just how unpredictable global virology can be? Even though the experts are feeling highly optimistic that this specific ship outbreak is just going to fizzle out, our global preparedness for things like this has never been more relevant. So keep an eye on the calendar, trust the hard data over the panic, and always stay curious. Thanks so much for joining me for this explainer.